And joining us live now to talk about the pandemic is Dr. Joshua Lenchus, Broward Health's interim chief medical officer. Doctor, thank you so much for joining us tonight. We've got so many questions, but let's start with this evening's breaking news. A CDC panel recommending now the Pfizer booster shot for teens ages 12 to 15. So what are your thoughts, and what are you saying to parents right now who have yet to vaccinate their children at all, never mind even thinking about the booster?
Yeah, thanks for having us. Just like the flu season that we're in right now, vaccination is incredibly important to protect patients from getting severe illness. COVID-19 is no different than that. The school-age children, they're back in school now. The masks are sort of left up to the parents. I think it's incredibly important to have the kids vaccinated.
All right, doctor, there's also some articles popping up, a lot of things I'm seeing on social media, including some healthcare professionals who say you might have a better chance with those antigen rapid at-home tests of getting an accurate result if you swab your throat first and then swab your nose, or in addition to your nose. So should you do that with these at-home tests, or just follow the instructions as listed? Obviously, since these tests came out, a lot has changed with these different variants.
Yeah, there's actually three ways that we test. One is in the back of the nose, the sort of nasopharyngeal route. One is just a nasal swab that you see right in the nostril, and then one is in the back of the throat. Since there are so many tests, it would be presumptuous of me to make a generalization. You really need to follow the directions on the back of the test. Those tests were studied with that specimen collection, and that's what really should be followed.
All right, important advice there for everyone who is lucky enough to get their homes on those at-home tests and be able to administer them themselves. Now, the governor and state surgeon general, though, telling people who do not have symptoms, asymptomatic, to not get tested. So do you think that's a good idea at this point?
Well, I think that has to be taken in context. Certainly, we know that when you have symptoms and you test with an antigen or PCR test, the test is a lot more accurate because you already have symptoms. If you were just exposed to a patient or someone who is infected and then you test tomorrow, the chances are exceedingly high that you will be negative because the virus has not had time to replicate enough to pierce that threshold where it can be detected by a test. So generally, we tell people wait a day or two, see if you have symptoms, or even see if you have any reason for you to have a test. And if you do, then go to one of the community testing sites rather than overrun the hospital emergency rooms for a test.
All right, and Florida among the worst in the nation, unfortunately, for the spread of Omicron. So what is it that we're doing wrong here? Are people just not taking this seriously enough? Obviously, there are different states have different mandates as far as vaccinations and masks. So is there something that Florida could be doing better to improve our positivity rates here?
Well, I'm not sure that we're necessarily doing anything wrong. I think we definitely rely on the community to continue to wash your hands, stay away from other people that are sick, wear your mask, get the vaccine. But when you look at this wave that we're experiencing right now and compare it to the wave that we experienced 4 or 5 months ago, the number of people that are being tested is significantly higher than it was before. So by sheer law of averages, the more people you test, the greater the chance of picking up those asymptomatic infected individuals. I'm not sure that the numbers that we had last summer were much different than the numbers that we have now, but the number of people that are tested are a lot higher now, and that's translating into more people that are infected.
Absolutely, yeah, especially with the holidays, people trying to get back to work, see what they need to do in order to get back to the office, if the offices are even open at this point. Now, if you're vaccinated and boosted, should you be any more worried today than we were a few months ago before this Omicron started spreading? We're hearing that it's not really as bad. People aren't getting as sick, right?
Yeah, in the last 3 weeks of the hospitals dealing with it, like my hospital, Broward Health System, and other systems around the region, what we're finding is that the people that are coming in with COVID are not quite as sick as they were during the last wave, which was predominantly the Delta. That's rather encouraging because that means that we can turn people around pretty quickly and get them out of the hospital and be prepared to take on the next people that need to come in.
Yeah, I'm hearing more and more about people who just go in for a few hours and are then able to get home once they get that treatment and get checked out by the experts at the hospital. Dr. Joshua Lenchus, thank you so much. Broward Health's interim chief medical officer. Thanks for being with us and all your medical insight, not just tonight, but all throughout this pandemic. Thanks so much.